Good afternoon. I'm Brent Roussin, Manitoba's Chief Provincial Public Health Officer. Today we're advising a 15th and 16th death related to COVID have been reported in the Southern Health Santé Sud region. These are two females, one in the 80s and one in the 90s. Both cases are from the Steinbach Health District and were previously announced cases connected to a known outbreak at Bethesda Place. We extend our condolences to friends and family. Our current 5-day COVID test positivity rate is 1.3%. 20 new cases of the virus have been identified today. This brings the total number of lab-confirmed cases in Manitoba to 1,264. 6 new cases in Prairie Mountain Health Region, 1 case in Interlake Eastern, and 13 cases in the Winnipeg Health Region. There are 457 active cases, and 791 individuals are recovered. 12 people in hospital with 1 person in intensive care, and the number of deaths, as we mentioned, is at 16. Preliminary investigations indicate that almost half of today's Winnipeg cases are close contacts of a known case. Investigations continue. An additional 1,339 tests were completed Wednesday, bringing our total to 140,982. Some updates related to our clusters. Total of 423 cases in Prairie Mountain Health Region since July 1st. Currently 247 active cases. 86 cases are linked to a business in Brandon, 46 which are active. In total, 20 cases have links to both the Prairie Mountain Health Cluster and the business in Brandon. There are a total of 300 cases related to communal living situations, with 104 active cases. The Bethesda Place outbreak has a total of 13 cases, 7 staff and 6 residents, and 4 unfortunately have died, as we mentioned today. Rideau Place has 1 total case, which is a staff member. No residents have been diagnosed. Assiniboine Center at the Brandon Regional Health Center, 7 total cases, 2 staff members and 5 residents. Hillcrest Place has 2 total cases, which are both staff members. Fred Douglas Lodge, 1 total case, which is a staff member. Beacon Hill, 1 total case, 1 staff. And Fairview, 2 total cases, 2 staff members. We've mentioned the new public health orders. We've seen increasing cases in the southern parts of Manitoba, and to protect our remote isolated communities, we are implementing again a northern travel restriction. This will come into effect tomorrow, Friday, September 4th. It does have numerous exemptions, which include people who live in or a person who is permanently moving to northern Manitoba, people who work for federal or provincial governments, a crown corporation or other government agency, or a child and family services agency. Health providers traveling to provide health care services, or people who are traveling for emergency medical purposes, educational professionals, including teachers or professors, includes students traveling to work or attend school or post-secondary institutions, people who own, operate, or work for a business, or traveling to deliver goods, public services, or operate a business, travel for trials, judicial proceedings, and travel for parenting arrangements. In addition, people can travel to and from a cottage, cabin, provincial park, campground, or hunting or fishing lodge in northern Manitoba. If they have no symptoms of COVID-19, they must limit their use of local services while traveling and staying at their final destination. They must travel there as directly as possible based on the means of transportation used. This means that if they plan to drive there, they must drive directly there. However, for more remote locations, there may be a drive or fly to a northern city and then a transportation to their final destination. People can also travel to Churchill and the surrounding area if they have no symptoms of COVID-19 and limit the use of local services while they're traveling there. They must travel there as directly as possible. This means they can fly directly to Churchill or drive or fly to another northern city and then be transported to Churchill. Visitors to Manitoba who must self-isolate for 14 days must not travel to northern Manitoba or a remote community until they are done self-isolating. People traveling to northern Manitoba on a public vehicle, such as bus, train, or plane, must wear a mask that covers their mouth, nose, and chin. In addition to these orders, all travelers are asked to respect any restrictions that First Nations communities have in place, as these communities are working with the advice of public health officials to ensure the health and safety of their residents. And for more detailed information, we can find at manitoba.ca/COVID-19. We have our current public health orders in Prairie Mountain Health Region, and that continues to be in effect at the orange level, the restricted level. This includes requirements to wear masks in indoor public places and reduces gathering sizes to 10 indoor and outdoor. Again, we note that there may be some Manitobans that are unable to wear masks, so please continue to be kind to each other. Long weekend coming up, and again reminding Manitobans to stick to the fundamentals during this time. If you're choosing to go out or gather with friends or family, ensure you're keeping the group sizes down. Stay home if you're ill, even mildly ill. Wash your hands frequently. Don't share items with others. Practice that physical distancing. And in indoor public places, do wear a mask. People who develop symptoms should self-isolate as soon as possible, no matter how mild they are. That includes staying home, avoiding others in your household. Don't go to religious gatherings or gatherings with friends, school or work. Do get tested as soon as possible. A fine for not self-isolating was levied this week in the Prairie Mountain Health Region. This was the first time since this order was implemented, and serves as a reminder that if public health informs you of the requirement to self-isolate, whether that being a case or a contact to a known case, you are required to do so. Again, as we are approaching respiratory virus season, we're advising employers to have plans in place to limit the burden on employees to stay away while they're ill. We don't want employees returning to work while they're symptomatic. We have a lot of questions regarding doctor's notes and the need for notes related to return to school, work, or extra activities such as sports. So public health guidelines do not require doctor's notes. Public health advises when individuals can return to work, school, or daily activities, notes should not be necessary and nor advised. There are reports of children accidentally ingesting hand sanitizer, and want to encourage parents and guardians to be careful and diligent in that regard. This isn't isolated to Manitoba, but a national issue, and more will be coming from Health Canada on that. And again, the issue that stigma plays a large role and impairs our ability to battle this pandemic. So please be kind to each other. Be certain we're not stigmatizing groups as we move through this pandemic together. So thanks again, and I can take some questions.
Dr. Roussin, that Bethesda place is it throughout the facility now, or is it one corridor, one wing, or how would you describe the outbreak there now?
Yeah, and I believe that it was contained with the first couple cases there were within one wing, but I do believe it's including two wings now. But we can follow up and get some more specifics on that.
Any special precautions now then at the facility, more over and above what was in place after the first case?
Well, no, right at the onset of the first resident being diagnosed, they declared the outbreak, which brings in a lot of restrictions, restricted visitation, it restricts residents to their rooms, increased sanitation. So there isn't much more on top of that we would implement other than fortifying that all the measures are maintained.
Started with a staff member though. Wouldn't the code red start as soon as there was a staff member?
Well, the initial case that when we looked back and involved that staff member was a scenario where it was in the asymptomatic phase, where when we did our investigation, there really didn't appear to be any significant contacts. So other than increasing measures in there, they didn't declare an outbreak right at that time.
You said on Monday that staff had been going between the care home and the hospital portion of that facility. What role, if any, did that play?
We haven't seen a role from that. We don't have any cases in the acute hospital right now. I think that staffing is certainly an issue when you have people off ill and self-isolating now. But certainly we didn't want our big one was really to limit this between multiple PCHs.
This is obviously our largest care home outbreak and the worst one. 4 deaths, 13 people. What else can you tell us about the investigation here?
Well, I think that it's when during that first wave where we did so well and there was many people on guard, I think that over time, just like many other Manitobans, there's we can lose track of some of the fundamentals on some of the importance of the strictness of our rules. So we don't have anything specific that we can mention on this, but this comes as a real reminder that we have to stay on guard.
On Monday, you suggested some healthcare workers were experiencing some fatigue in terms of wearing the PPE. Are we to assume that this outbreak has resulted from some healthcare workers not always wearing their PPE at Bethesda Place?
Yeah, well, I can't speak specifically to Bethesda because we're, as we investigate, there's, different links. We have that first individual where we didn't feel there was a PPE breach on there. Just in multiple investigations and not necessarily just in PCHs, we hear of, some PPE breaches in healthcare settings. And again, it's really challenging to be, many hours a day strictly adhering to these measures. So we just need to ensure everyone's aware of how important it is.
Prior to the first case at Bethesda, there had been a number of cases in the Steinbach area, correct? So was this then as a result of community spread within that area?
Well, it sure could be. With the initial case, I think we of the healthcare worker, we would probably consider a community transmission on it. I don't think we have necessarily a specific link to it. So it's it's one of those things where we have to be alert at all times, especially in these high risk settings.
Is that true too of the other cases involving personal care homes, likely? People who work there just picked it up in the community and all of a sudden they're identified and they just happen to be care home workers?
Yeah, I mean, it pretty much has to be that way because the only other explanation was that they'd be named a close contact and they shouldn't be at work, right? So almost by definition we would see it that way.
Mm-hmm.
Do we know how many of the active cases are linked to the Bethesda place, actually? Like
so we know we have the 13 that are directly related to it. So the 7 staff and the 6 members. So I don't have a number on how many of their household contacts might have turned cases. No, so I don't have that.
So, go ahead, Larry. You did mention, switching topics, the Churchill briefly. There's some confusion in terms. We see people canceling trips there as a result. Once people can go to their destination, but a destination like Churchill is a large, can tourists freely move about in Churchill and the wild environs around it if they go there?
Right, within the Churchill and the surrounding areas, the only restrictions would be the overall public health orders. not the northern travel restriction.
Thank you for clarifying
Could
that.
they go up by train then?
Yes, yeah, we would have to wear that mask though while on a train.
A quick question about Dynacare. Could you explain its role these days in terms of handling laboratory tests? What percentage would it be doing or handling? And is it just there for surge capacity? Is it handling many at all?
No, it's handling routine samples, so I don't really have, I don't want to give a number because it does fluctuate, but a substantial, a significant proportion of our samples are run routinely at Dynacare.
So the Dynacare is there mainly for surge capacity for the fall, or like from some of the numbers recently, it appears that there's maybe more than CADM's been able to handle, but I'm wondering how much more. Is it a few hundred a day or?
Yeah, it's not simply surge capacity. They're part of our routine lab capacity with it. So they're not only there just to as an overflow. There's certain samples that are directly going there.
So if there's 1,500 or 1,600 samples tested in a day, would Dynacare have what, 200, 300, 400 of those?
Sometimes more than that.
Dr. Roussin, we've seen some in the past with the healthcare system issues that your counterpart, the healthcare systems lead, Ms. Zaragoza, speaking on this. Is she going to address the multiple care home outbreaks at some point soon?
Well, we've already been engaging all those groups and the healthcare sector fully, just to as a reminder on the importance and just to solidify all the steps that are required. The step of screening to ensure watching for those symptoms developing, the strict use of PPE and distancing. So we already have been doing that.
Other than PPE fatigue, do you have any other explanation for the number of outbreaks we're seeing now in care homes?
Well, I think we're seeing just more cases. So just by average, you're going to see more healthcare workers acquiring it in the community.
And changing topics to back to school, will you commit to a daily tally of infected students, teachers, and other people who work at schools?
Yeah, we're going to plan on including that in our pandemic response system. So a positive infectious case in the school, we're going to announce what schools affected and probably what cohort. It certainly will be doing our investigation first, notifying close contacts, notifying those most affected, and once everyone's notified, then we plan on publicly letting people know where cases are.
So there will be. Okay, that answers a question from yesterday, because the plan outlined yesterday, the detailed plan suggested that parents may not be notified about an outbreak or about an infection if that infected patient isn't a close contact of their child. But if you're saying that they will eventually know what schools.
Right, yes, yeah. So it would go in the order of, case, contacts, school, and then public.
All right, Doctor, we're going to go to the telephone for a few reporters now, starting first from CTV. Michael.
Hi, Dr. Roussin. I know it's only September, but we're kind of looking ahead to Halloween. It's in a couple of months. Do you believe that it'll be safe for children to go door-to-door trick-or-treating, or should the event kind of be canceled this year in the province?
Yeah, I think it's probably too early to comment on that. I don't think we should look to cancel it at this point. I think that we're going to have to see what our numbers are. This is largely an outdoor event. It'll certainly look different than it normally does. But I wouldn't want to say at this point that there isn't a way it could still happen.
And then to switch topics, as you've already spoken about, we are seeing outbreaks at multiple care homes with 2 new deaths. Is it time to reimpose visiting restrictions on all care homes where any visitors aren't necessarily able to go in to limit the spread of the virus?
So I don't, I think that we have to ensure that, just like we are with healthcare workers, that visitors are aware at that heightened level, that the screening is vital, that their mask use and hand sanitization is vital. At this point, we're not looking to further restrict visitors. In fact, the current outbreaks where we haven't implicated visitors in these current outbreaks. So we're going to watch that really closely, especially as we get into the respiratory virus season, we're going to have to be really on guard.
From City News, Jonas.
Good afternoon, Dr. Roussin. Over the last few days, we have seen the overall caseload dropping, the test positivity rate going down. These clusters, are they seeming to be more manageable past the infectious state? Just a comment on that.
Yeah, and so it's early, so we do see some of the case counts, the test positivity rate declining. It's an early trend, so we can't really make much of it. We know that the non-EpiLink cases, the number in their 7-day running tally is also declining over this time. So it's an early trend, and it's very likely that this is what our foreseeable future will look like. Many peaks and valleys of the cases. We'll see it peaking here and declining in other parts of the country. You might see it peaking in one part of the country while it's declining here. So it's part of our new normal that we're going to continue to see cases moving forward.
No follow-up. Thanks.
From Global, Melissa.
Hi, Dr. Roussin. It's Malika from Global News. Just wondering about teachers. We had a teacher call in to us for was wondering if there could be a hotline for educators to report things that don't seem to be fitting with public health requirements in schools. Is there any sort of talk about that with the education department? Talk about if they could raise concerns about schools getting sloppy or screening their kids or anything like that. Is that going to be implemented when the year starts?
So we don't have anything specific in that regard. Certainly, we work very closely with education, and there's those open channels, and so I think there's a lot of channels that we want to have directly from schools and divisions with local public health. So I think that there's going to be lots of opportunities to work with schools moving forward. So I can't really comment on a hotline that we have, but I think there's a lot of channels that people can bring concerns through.
Okay, and just to follow up on a different point here, we had a Probe Research poll saying that majority of people that they polled here in Manitoba were looking to have mandatory masks implemented, that they were for mandatory masks for indoor places. Does this factor into your decision? Does it start a conversation potentially to get maybe something happening here in Manitoba for mandatory masks for indoor areas?
Well, I mean, certainly we saw with our phases, we certainly are interested in the public's thoughts on things, so it's certainly relevant, not necessarily conclusive. When we look at mandating things, I mean, really the only reason to mandate something is to increase adherence to it. And so if we have that 80% of Manitobans are interested in wearing masks indoors, then we may not have to mandate it if we have 80% of people who are willing to do things. So it's something that we consider. It's certainly not conclusive, but you've seen our messaging on masks has increased. You've seen our incremental approach where we've mandated masks in the Prairie Mountain Health region, now mandating it in northern travel for travelers there. So, so our messaging is clear. We really support the use of masks indoor public places, and if a lot of Manitobans are behind that, then we may be good even before needing to mandate it.
From the Brandon Sun, Colin.
Hi, Dr. Roussin. Colin from the Brandon Sun here. I am sorry if I missed this, but has public health determined yet what the source of the virus at the Assiniboine Center at the Brandon Hospital is?
I don't know if I can necessarily specifically comment on that. I think that there was a resident that tested positive, but had been admitted much longer than the incubation period. and then we've had staff members that had tested positive. So we don't have necessarily the direct link, but it certainly wasn't the resident because they had been there longer than the incubation period.
My second question is on a different note. I was wondering if you could tell us what your specific definition of communal living is, because I think people hear that and automatically assume that it's Hutterites, but I would like to know if it also applies to other living situations as well.
Yeah, and so we really wanted to report on this because the communal living cases were geographical clusters that were sort of tight clusters that were certainly not with a lot of contacts in other populations. So when it was making up a lot of our test positivity, we wanted to distinguish that somehow, do so without necessarily calling out certain groups. And so our definition of communal living is just that, a tight cluster located in geographic terms. And besides that, we just want to really avoid trying to identify specific groups.
From CJOB, Clay.
It so happens the questions I have here have all been. Thank you.
From the Winnipeg Sun, Scott.
Good afternoon, Dr. Roussin. There's an internal email that went out through government earlier this week on masks, considering a mandatory province-wide mask mandate. And one of the things that the email said is that the province needs to prepare for this eventuality. How quickly would this come? And obviously it's clearly on the table. So how quickly would it be that this might be implemented?
Yeah, and so we certainly haven't decided on that. Just like many other things we implement, we have to plan ahead so that when we do, or if we do decide to implement it, we can do so and have everything in place. So that's the stage that we're at. We are planning for for increased mask use, and you've seen that increase over time. But we don't have a specific date. We haven't landed that we would be mandating it. So it really just depends on the epidemiology, and it really depends on mask use. If there's widespread mask use without mandating it, then we might not need to mandate things. So it just really depends on a number of factors.
Okay, and my follow-up is just looking at the dashboard. Half of the 90-year-olds in that age group that have contracted the virus have died. What is being done or can be done to perhaps better protect that age group, given how vulnerable they seem to be?
Yeah, and we knew early on this pandemic that one of the biggest risk factors for severe outcomes of this virus was increasing age, and sort of 65 and up, but that increases with the passing years. So this was largely why we really locked down PCHs early on, why we still have a number of factors in place in those areas, and it's also just our messaging right from the beginning that as we try to restart a number of things in our economy, there are people that are at significant risk of severe outcomes, and they have to take extra caution.
From the Canadian Press, Kelly.
Kelly Malone, the Canadian Press. So I'm also looking at the dashboard, and we have 164 active cases in Winnipeg. The larger outbreaks that we hear a lot about are obviously outside the city. So can you speak to the numbers in Winnipeg, which have been in double digits of new cases for a couple of weeks now?
Yeah, so we still see the majority of those cases linked to known cases, or sometimes to travel. About around that 20%, 1 in 5 are what we would consider non-epi linked, or or community transmission. So we haven't really seen an escalation in that proportion over the last little bit, but we're still strong messaging on the fundamentals, right? So this virus is there. We're seeing these cases, Many of them were just related to close household contacts, but that virus is circulating in the community. So we can't let our guards down. We have to continue to practice those fundamentals to try to reduce the spread.
And apologies, I know you did answer this, but it was difficult to hear. Can I just get a confirmation that you do plan to notify all families in any school if a student or teacher tests positive?
Right. Yeah. So the just in the nature of it, to be clear, so we would do a contact investigation, and so we would be public health would be contacting people who we consider to be close contacts, advising them to self-isolate, contacting them daily as they are. To the school as large and to the public at large, will be announcing where cases are. So public health won't be personally advising all parents in a school, only those that are close contacts. But we will be making it public when we have a case in a school.
From CKTJ, Vic.
Yes, thank you for taking my question. I'm Vic Krasowski from CKTG Radio News in Thunder Bay. Our medical officer of health in the Thunder Bay district commented that with numbers increasing in Manitoba, if people from our district are going there, they should be aware and take all the appropriate precautions. Your thoughts on that?
Yeah, and I think this is part of our new normal. And so you could see that early on in what we would call our wave one. It was me giving the advice to Manitobans to not travel to other areas, and in fact imposing 14 days of isolation should they. And now at this point, our curve is trending up, and so we have to. There'll be other places that will be cautious with us. So I think that this is what we'll see moving forward. We'll see. Cases going up and down, peaks and valleys on the curve, and that might not coincide everywhere in the country at the same time. So it's part of that new normal, that traveling at home, doing errands, we can't get away from the fundamentals.
Now, are there certain areas that we should avoid from this area to go for visitors? We understand it was mostly confined to colonies, Hutterite colonies, that we wouldn't be in contact with them anyway.
So, we had a significant proportion of our cases related to communal living. However, if we look in our Prairie Mountain Health, which is one of our health regions, we've elevated their level of caution to restricted. We've reduced group sizes in that Prairie Mountain Health region because of a number of cases that weren't just related to communal living. In Winnipeg, we see many cases, again, related to mostly known cases, but there is community transmission. So really the advice is no matter where you're going, inside or outside of Manitoba, during the pandemic right now, we can't get away from the fundamentals.
From Arctic Radio, Blake.
Hello, this is Blake Priddle calling. I have a question about the travel restrictions. First of all, if northern Manitoba residents visit southern Manitoba or another area of the travel bubble, like, say, northwestern Ontario, will they be required to self-isolate upon returning home to northern Manitoba?
No. So our travel restrictions, our northern travel restrictions, have never impacted the travel within northern Manitoba, nor has it impacted the travel of northern residents outside of the north.
I'm sorry, did you say no?
That's right.
The other question that I have about the travel restrictions is that is there a possibility that it could be open to other regions anytime soon, like, say, northeastern Ontario?
Well, I mean, just like any of our orders, we were continuing to look at them, and so so there isn't any imminent plans right now regarding our interprovincial self-isolation orders, but we are always reviewing it. So those things could always change.
Thank you, Doctor. We now return to room 68.
Dr. Roussin, the number of, do you have a figure offhand for the number of staff and residents at Bethesda Place?
Oh, no, I don't have that offhand, sorry.
I noticed that the number of deaths went up by 2, number of hospitalizations by 2, but still 1 in ICU. Were neither of the 2 people who died in ICU?
That's correct. Yeah, they were in hospital, but not in ICU.
Doctor, and also, do you know how many staff are isolating at home from Bethesda?
No, sorry, I don't have that number.
Was communal living area targeted testing, has that continued in recent days?
I don't think we've had any big events going on in there, so we still have a number of tests going on, and we still see cases, but I don't think there had been any targeted events.
Would it be correct to assume then that the relatively lower numbers of cases we've seen this week, 13, 20, etc., versus 40, 50, 70, is the result of the targeted testing not taking place?
Well, certainly those days where we saw that 90 and the 60 there, the large proportion of those were those intentional testing strategies. So they did play a role in those large testing days, yeah.
And I'm confused between your answers to my question and to Kelly Malone's question about the reporting of the cases in schools. It's the reporting only of cases where there was an infectious case and there was exposure, or all cases related to teachers' school?
Yeah, I mean, like it's there probably isn't going to be many times where there's that can be distinguished. So I mean, it really would technically be an infectious case. If a child tests positive but was never infectious while at school, there's no risk there. But for that to happen would be unlikely, since there's only sort of the 2-day weekend and things. So, but yeah, so an infectious case we would report. We would always err on the side of caution with that. But if there was some circumstance where a child tested positive but wasn't anywhere near the school for their infectious period, there wouldn't be a need to note that.
And further to the Thunder Bay reporter's question, I understand that there's little appetite for reducing any restrictions right now, but logically, if Manitoba and Alberta are the highest risk places, would it not make more sense to target Alberta or to change the travel restrictions to something that rotates on where the risk areas are at a given time?
Yeah, and it's I think it's challenging when we put these orders in, especially for things like travel orders, to move them up and about and change the destination. It has really big implications, and it's difficult to manage. So I'm really thinking in our new in the new normal. Certainly, the international travel restrictions are important. I think as we move into respiratory virus season, we'll see that there's times when we're starting to peak and other places going down. That there may not be a huge role for interprovincial type isolation orders.
So does that mean, will we be seeing the end then of this eastern ban soon then?
Well, as you know, we had the end of that in phase 4. And we truly do listen, to the opinion of Manitobans, and I think it was quite clear at that time. However, we're now, over a month from that consultation period, so we're continuing to review it. Like I said, I don't actually have immediate plans of doing that, just because of we're dealing with our cases here right now. But but the future of the interprovincial travel restrictions are probably, still yet to be decided.
Of the 16 deaths so far, were there any at all where the person didn't have underlying health conditions?
Not that I'm aware of, no.
Dr. Roussin, could you tell us more about the fine issued in Fairmont Health? Is it a close contact or someone coming back for travel?
Yeah, so this was a case, a diagnosed case, who was to be self-isolating, that had very clear information that they weren't self-isolating, even though they were a diagnosed case. And like almost everything we do in public health, there's attempts to try to rectify that before leaning to this, but ultimately the fine had to be levied.
Do we know?
Time for 2 more questions.
Do we know how old is he or she? Do we know?
Yeah, I won't give details about the case. Just that it's that it was it's important moving forward. The case identification, case isolation, contact identification, isolation are just the largest part of public health's ability to reduce this, and anything that contravenes our ability to do that really puts us all at risk.
Doctor, are we in the first wave, second wave, wave 1.5, or does it even matter what wave you call it?
Yeah. I mean, I think I would say that to clearly distinguish it like that, it's probably not necessarily important. If you plot on the graph, you clearly see two waves. So when we're starting to do some of our analysis now, we're breaking it down to see how these two waves look different. And so one clear thing, which we don't have the specifics on yet, is that the cohort of cases here are younger than the first cohort, and that probably explains a lot of why our hospitalization rates are down.
Anything else? Okay. Thank
Give
you.
us a second, I'm sure we'll think of it.
I'm sure you will. Thanks.
Thank you very much, Doctor.